Everyone, a very good morning to all of you. Am I clearly visible and audible to you people? Let me confirm in 1 second. If I'm clearly visible and audible to you people, then I will start the session. Just give me 1 second. Let me confirm it. Okay. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, NEET PG educator on an academy. And today I am here to start a series that is Pharma Daily, Pharma Once Daily. So in this series daily, I will take one topic from pharmacology and I will discuss that topic in detail along with MCQs also. I will give you theory also, MCQs also. So today's topic I am starting is autonomic nervous system, the most difficult system in pharmacology I have found. And students also find it. Yes, I guess. So I'm starting with autonomic nervous system. In autonomic nervous system, today I will discuss the general concepts and I will discuss the classification of all the drugs in autonomic nervous system. So without wasting time, I'm just starting it. If you have any doubt, you can write in the chat box and I will address it. So what is autonomic nervous system? Before studying the drugs of autonomic nervous system, 4 chapters here we have to study. Cholinergic drugs, anticholinergic drugs, adrenergic drugs and anti-adrenergic drugs. So in all the 4 chapters that is in autonomic nervous system drugs, before starting it, I will discuss them one by one. Before starting autonomic nervous system, you should know what is autonomic nervous system. So we know that in nervous system, humans have two nervous systems, central nervous system and peripheral nervous system. Central, let's talk about central nervous system. Central nervous system contains brain and spinal cord. You can see this is the brain. You can see here this is brain and this is spinal cord. Yes. So brain and spinal cord constitute the central nervous system. And the nerves arising from it is peripheral nervous. This is central nervous system, brain and spinal cord. The nerves arising from it, nerves arising from central nervous system will constitute peripheral nervous system. So the nerves arising from brain are known as cranial nerves, and the nerves arising from the spinal cord are known as spinal nerves. So we have, humans have two types of nerves, cranial nerves and spinal nerves. How many cranial nerves do humans have? How many spinal nerves do humans have? Does anyone know? Yes. So we have 12 pairs of cranial nerves and 31 pairs of spinal nerves. You can see here in the diagram, we have 12 pairs of cranial nerves. You also know the name of number 1, number 2, number 3. You know the cranial nerves in detail. The names also and their details also. That is 12 pairs of cranial nerve. Coming on spinal nerve, we have 31 pairs of spinal nerves. Out of the 31 pairs, 8 are cervical, 12 are thoracic. Thoracic also known as dorsal. 5 are lumbar, 5 are sacral and 1 is coccygeal. So total 31 are there. So this is how we have cranial and spinal nerves. So any nerve is it, whether it is cranial, whether it is spinal, it is of two types. It can be of two types, sensory and motor. Sensory and motor. Sensory nerves also known as afferent nerves and motor nerves are also known as efferent nerves. And some of the nerves are mixed, which have both sensory and motor component. What are sensory nerves? Which carry signal from organ to the central nervous system. That is, look at the arrow. From organ, these all are organs. From organ towards the central nervous system. These all are sensory or afferent. And motor nerves are those nerves which carry signal in opposite direction. That is from central nervous system towards the organ. That are motor or efferent. These are the basics we already know. Currently, for explaining ANS, I am concerned here with motor nerves. I am not concerned with sensory nerves. So we know what are sensory nerves that carry signal from organ to CNS. What are motor or efferent nerve that carry signal from CNS to the organ. Yes, I am concerned here with the motor nerves. Motor nerves are of two types. That is somatic and autonomic. Autonomic nervous system. अब आया autonomic nervous system role में. So somatic and autonomic. These are the two types of nerves. Motor nerves. You can see. So what is the difference between them? Look at the arrow. The arrow is same. All these nerves are carrying the signal from the central nervous system towards the organ. But depending on what organ they are supplying. So if they are supplying a voluntary muscle, that is skeletal muscle, it is known as somatic nerve. And if they are supplying involuntary muscle, that is smooth muscle, we have skeletal muscle which is voluntary, my bicep, my tricep, my deltoid, these are skeletal muscle. And we have involuntary muscles, the peristalsis in the intestine, the beating of the heart. These are not in our hands. They do not function with our wish. So these are involuntary muscles, that is smooth muscles. So the nerve supplying to them, that is heart, intestine. So these are known as autonomic nervous system. Today my topic for teaching is autonomic nervous system. So I will deal with smooth muscles, involuntary muscles. Again, why I have drawn two autonomic nervous system? Autonomic nervous system again of two types. You understood the difference between somatic and autonomic. The organ is different. In somatic, the organ is skeletal muscle, and in autonomic, the organ of supply is smooth muscle. You got this. You got this. Now, what is the basic difference you can see in somatic and autonomic? What is the basic difference you can see in somatic? See this now. This is a single nerve. So it is starting. The neuron is starting. What is the nerve? Nerve is the axon of a neuron. You can see this is the cell body of the neuron. It is present inside the CNS. And the nerve is starting from CNS and it is ending in the skeletal muscle. So single, one nerve, one axon. One nerve, one axon is present in somatic system. But see at autonomic nervous system, both the nerves below. See, the arrow is same. It is towards the organ. But see, there are two nerves. So this is the one cell body, this is one nerve, this is another cell body, this is another nerve. Again here also one cell body, one nerve, another cell body, another nerve. So two nerves are there. Both the nerves are meeting at a point that is known as synapse, or it is also known as ganglion. Ganglion is the junction of the two nerves. So here the axon of one nerve will meet with the dendrites of another nerve. Done. So that is known as ganglion or synapse. Now see, the synapse is not at the center. I have not drawn the synapse at the center. So if it is, just a second, if it is towards the organ, in that case, this nerve, this is known as preganglionic nerve. It is longer than postganglionic nerve. You can see very clear in the diagram. And this system is known as parasympathetic. So in parasympathetic, the ganglion or the synapse is towards the organ. It is towards the organ, affected organ. So preganglionic fiber is longer than postganglionic fiber. See the other way around. Here in the second diagram, you can see the ganglion is towards the CNS. So here preganglion fiber is shorter and postganglion fiber is longer. So this system is known as sympathetic system. So these are the structural differences between sympathetic and parasympathetic nervous system. These are the two types of nervous system which are present under ANS, autonomic nervous system. So we have studied two types of systems, that is parasympathetic system or sympathetic system. In parasympathetic system, the ganglion is close to the organ. So that's why preganglion is long, postganglion is short. In sympathetic, the ganglion is close to the CNS. That's why preganglion is short and postganglion is long. So it is clearly visible here. What we have studied, it is clearly visible here. One more thing, as I have told you, humans have 12 pairs of cranial nerves and 31 pairs of spinal nerve. Cranial nerves have specific name, 1, 2, 3, 4. Spinal nerve do not have specific names. So 31 pairs are there. But how many of them are cervical? How many of them are lumbar, sacral, coccygeal? You know. So there are total 31 spinal. Out of these, how many are parasympathetic and how many are sympathetic? So let me talk about parasympathetic. Parasympathetic, if you talk about brain, cranial nerves, there are only 4. Out of the 12, only 4 nerves. Out of the 12, only 4 nerves. That is nerve number 3, you know. Nerve number 7, that is facial. Nerve number 9 and nerve number 10. So these are the 4 nerves which are parasympathetic. So out of 12, these 4 you have to learn. So nerve number 3, nerve number 7, 9 and 10. These are the 4 nerves which are parasympathetic from the brain. And from the spinal cord, we have 5 portions in the spinal cord now. That is cervical, thoracic, then lumbar, then sacral, then coccygeal. Among them, only sacral ones are parasympathetic. So it is known as, the other name of it is sacrococcygeal, craniosacral. Cranio, because the 4 nerves from the brain, and sacral. You can see the name here. It is known as craniosacral. It is craniosacral. If we talk about parasympathetic, none of the 12 cranial nerves is sympathetic. None of the cranial nerve is sympathetic. From the spinal nerves, only dorso and lumbar, that is thoracic and lumbar nerves are sympathetic. That's why it is known as dorsolumbar or thoracolumbar. So you can see here, all the nerves are arising from thoracic region and lumbar region here. That's why it is known as thoracolumbar. Give me a thumbs up if you got it. So that was the beginning here. One more thing I would like to tell you here. So here also you can see the same diagram. You can see here the ganglion is towards the organ. So pre is longer and post is shorter. So it is a parasympathetic system, and here the ganglion is towards the CNS. So pre is shorter and post is longer. So it is known as sympathetic nervous system. Done. In parasympathetic, here muscarinic and nicotinic receptors are there. In sympathetic, alpha and beta receptors are there. So we will study these receptors also in detail. So we have studied. So this is the same diagram from KDT showing the same detail. You can see here. You can see this is a somatic system. You can see only one neuron is there, which is starting from CNS and ending in skeletal muscle. So this is the somatic system. In autonomic nervous system, you can see the first diagram. This is the first neuron. This is the second neuron. And see the ganglion here. So ganglion is towards the organ. So pre is longer than post. You can say it is parasympathetic. And here in all these diagrams, the ganglion is towards the CNS. So pre is smaller, shorter, and post is longer. So these all diagrams are of sympathetic system. So that is the same thing shown here. So we have completed it. One more thing here I would like to tell is neurotransmitters. What are neurotransmitters? I'm sorry. So you know all these information, that is motor nerves are carrying the information from CNS to the organ. The information is carried in the form of some chemicals. The chemicals are known as neurotransmitter. In somatic system, the neurotransmitter is only one, because one neuron, one neurotransmitter, that is acetylcholine. But here in autonomic nervous system, we have two neurons. That's why we will require two neurotransmitters. In preganglion 1 and postganglion 1. In preganglion, it is always acetylcholine, whether it is sympathetic or parasympathetic. Preganglion fiber neurotransmitter is acetylcholine. Postganglion is different. In postganglion neurotransmitter, in parasympathetic system, again it is acetylcholine, and in sympathetic system, it is noradrenaline. So it is the postganglion neurotransmitter which decides the name of the system. So here you can see in parasympathetic system, it is acetylcholine. That's why it is known as cholinergic system. And in sympathetic system, it is noradrenaline. It is known as adrenergic system. So cholinergic and adrenergic are the other two names given to these systems. So parasympathetic system also known as cholinergic system, and sympathetic system also known as adrenergic system. So this is the summary you can see. So tell me the summary. What is the summary you can see? So in somatic system, only one neurotransmitter, that is acetylcholine. In autonomic nervous system, we have two neurotransmitters, one at preganglion and one at postganglion. Preganglion is always acetylcholine, whether it is sympathetic or whether it is parasympathetic. But postganglion is different. In postganglion, if we talk about parasympathetic, again it is acetylcholine. So both are acetylcholine. That's why it is known as cholinergic system. And in sympathetic, it is noradrenaline at the postganglion. That's why it is known as adrenergic system. So this is the basics you should know. So this is the summary what I have taught you. Neurotransmitters in somatic system, it is only one acetylcholine. That's it. Today I am not teaching somatic system. It is not my concern. I am teaching you autonomic nervous system today. So in autonomic nervous system, we have two types of autonomic nervous system, sympathetic and parasympathetic. In sympathetic, preganglion is always acetylcholine, whether it is sympathetic or parasympathetic. Postganglion is different. In parasympathetic, again it is acetylcholine. In sympathetic, mostly it is noradrenaline, but sometimes it is adrenaline, dopamine, and acetylcholine also. So that is the summary till now we have seen. So parasympathetic system, the other name is cholinergic system. Sympathetic system, the other name is adrenergic system. Now let me talk about the action. Which system is present in which organ? So can you see this diagram? So I have drawn an eye here. So this is the eye. This is the salivary gland. This is pupils of the eye. This is salivary gland. This is heart. These are two lungs. This is the whole GIT, intestine, GIT, stomach. This is the urinary bladder. So in all organs, all human organs, both nerves are present. So which organ contains which nerve? All organs contain both nerves. Parasympathetic also, sympathetic also. So at this moment, inside you, inside me, which system is activated? I'm teaching you. You are studying from me. You are listening my lecture. I'm teaching you. So at this moment, which system is activated in each of the organ? So whenever we are relaxed now, at that point, parasympathetic system is activated. But whenever in case of any emergency, there is a tiger in front of me, I have to save my life. I have to run. So any emergency, I have to appear in an exam. I'm having so much anxiety. So whenever in any emergency, sympathetic system will get activated. So all the organs either will receive parasympathetic nerve supply, activated parasympathetic or activated sympathetic. So they are supplied by both, but at a time only one of them is activated. At a particular moment, only one of that system will be activated. If parasympathetic is activated, all the organs will have parasympathetic action. If sympathetic is activated, then at that time all the organs will have sympathetic actions. Done. So currently I am teaching you, I am relaxed. You are studying from me, you are relaxed. There is no emergency, there is no life-threatening condition, life-saving condition. So it is not an emergency. So during relaxed state, we have parasympathetic system. And during emergency, we have sympathetic. We will see organ by organ. So if we talk about the first organ, pupils of the eye. So currently pupils are constricted. If you see my pupil, your pupil, it is constricted. It is narrow. We do not want wide pupil because we are relaxed. But in case of emergency, आंखें फट जाती हैं, कहते हैं ना, we just do mydriasis in the eye. So there is dilatation of the pupils during emergency. If I talk about salivary gland, currently I am in relaxed state. If you offer me something, I can eat. You can also eat. You can have your breakfast. You will eat something. So we need saliva in our mouth during relaxed state. So here in parasympathetic system, increased salivary production is there. But whenever we are in emergency, there is a lion, there is a tiger in front of me. There is no time to eat. Na? In exam, I don't have time to eat. So it inhibits saliva secretion during parasympathetic system. If you talk about the heart, currently my heartbeat is less. My heart rate is less. But in case of emergency, we know heart rate increases. Just before exam, during exam, we have tachycardia. Yes. So that is about heart. About lung, what about lung? So during relaxed state, I don't need more oxygen. So my lungs, my bronchi are constricted. They are constricted because I don't need more oxygen. But during emergency, I need more oxygen. I have to run. I have to save my life. So my bronchi are dilated. My bronchi are dilated. So that is about lung. So eye हो गया, salivary gland हो गया, heart हो गया, lung हो गया, intestine में same thing. Currently, I can eat anything. I can digest anything. So my digestive organs are stimulated. Peristalsis is on, it is going on, but during emergency peristalsis will be inhibited, digestive organs and the whole GIT will not function. Urinary bladder also, currently in relaxed state, we can go to the toilet and void the urine. We can do the micturition because we are in relaxed state. So bladder can constrict and urination can occur. Micturition, the process of micturition can occur. But during emergency, we don't have time for micturition. Yes. So at that time, bladder is relaxed. It won't contract. So you won't feel a sensation of the micturition. So bladder relaxed in emergency. Done. So these are the differences you should know. These are the basic differences. We will take the 4 chapters. We will take the 4 chapters: cholinergic, anticholinergic, adrenergic, anti-adrenergic, alpha blocker, alpha beta blocker. We will take all chapters one by one daily. Don't worry. But these are the basics you should know. So till this end, do you know the difference between somatic and autonomic nervous system? Yes or no? So what is somatic nervous system? Somatic nervous system has single neuron which supply a voluntary skeletal muscle, and autonomic nervous system have 2 neurons which supply smooth muscles or involuntary muscles. That is the basic difference we have studied. And what is the difference between sympathetic and parasympathetic? The 2 types of autonomic nervous system. So sympathetic arises from thoracic and lumbar, only from the spinal cord. None of the cranial component is there. But parasympathetic from cranial, there are 4 cranial nerves: 3, 7, 9, 10. 3, 7, 9, 10. Never forget, write in Roman number. Cranial or sacral, spinal cord में से sacral component. Spinal cord में 5 component होते हैं: cervical, thoracic और dorsal, one and the same thing, lumbar, sacral and coccygeal. So from these 5 components, sympathetic have these 2 components and parasympathetic have this component. You have to learn it. So many MCQs arise from it. And here preganglion is long, post is short. Here post is long and pre is short. You know the reason. Here ganglion is closer to the organ. Here ganglion is closer away from the organ. Here it is closer to the organ. So you know the differences and you know the this thing also, neurotransmitter also. So that was the basic. Now we have to study these 4 chapters: cholinergic, anticholinergic, adrenergic, anti-adrenergic, one by one. Cholinergic system are the drugs. All these systems have certain drugs. I will tell you the classification of all 4 systems. Don't worry, I will tell you the classifications. Listen first what I am teaching you. So cholinergic system have the drugs which will do the same thing as parasympathetic system is doing inside our body. So whenever my parasympathetic system is activated, my pupils are constricted, my salivary gland is stimulated, my lungs is constricted, my heartbeat is reduced. You know, I have explained you. So these drugs are doing the same thing which my natural parasympathetic system is doing. That's why it is known as parasympathomimetic drugs. They are mimicking parasympathetic system. So parasympathetic mimetic drugs are the same as that of cholinergic system drugs. Anticholinergic drugs will do the opposite of parasympathetic system. So they will do the opposite. So they will dilate the pupil. They will not constrict. They will dilate the pupil. In salivary gland, they will constrict. They will inhibit the secretion. They will, in lung, they will dilate the bronchi. In heart, they will increase the heart rate. So they will just do the reverse of parasympathetic system. That's why known as parasympatholytic. Can I say they are same as that of sympathetic system? So parasympatholytic are same as that of sympathetic system actions, because they are doing opposite of parasympathetic. Done. The third system is adrenergic. The third system is adrenergic. They will do the same thing as sympathetic system is doing inside my body. That's why known as sympathomimetic. Sympathomimetic. And anti-adrenergic drugs, they will do opposite what sympathetic system is doing. So these are known as sympatholytic. Sympatholytic systems. Have you got it? So can I say these two systems will have same action and these two systems will have same action? समझदार के लिए इशारा काफी है, मैंने broad बता दिया. So cholinergic drugs will have same action as that of anti-adrenergic drugs, or anticholinergic drugs will have same actions as that of adrenergic drugs. Give me a thumbs up if you got it. And I have told you other names also. I have told you the basics. Let me tell you the classification of the 4 drugs. Give me a thumbs up. Just, I can't see your chat. Just give me 1 minute. Okay, now I can see the chat. Okay. So I am starting with the first chapter. For understanding cholinergic or parasympathomimetic drugs, you have to understand acetylcholine. I am starting with this system. See, cholinergic system, cholinergic drugs. That is parasympathetic system. So we have 2 neurons. The first neuron is here. This is the first neuron. And this is the second neuron. And this is the ganglia. The junction of the 2 neurons is ganglia or synapse. We can see this is preganglion. This is postganglion. We can see ganglion is towards the organ. Towards the organ. So preganglion is longer and postganglion is shorter. So preganglion is longer than postganglion. This information we can see here. One more information which is visible clearly here is that here both the neurotransmitters are acetylcholine. At preganglion also we have acetylcholine. At postganglion also we have acetylcholine. That's why it is known as cholinergic system. That is the reason why it is known as cholinergic system. So before starting the classification, you should know everything about acetylcholine. Let me tell you how, in short, acetylcholine, how it is synthesized. As I have told you, here acetylcholine is secreted and it will go to the organ and do the necessary action. If it is heart, it will decrease the heart rate. If it is lung, it will constrict the lung. If it is eye, it will constrict the pupil. It will do meiosis. So whatever organ it is, here acetylcholine will do that action depending what organ it is. So how acetylcholine is synthesized here? So listen, it is synthesized inside the axon. Can you see? This is the axon. This is the axon. This is the cell body. This is the axon. So it is synthesized inside the axon and stored inside the axon in the form of the vesicles. So these are synaptic vesicles. So whenever nerve of depolarization will arise from the brain, at that time these vesicles will secrete, they will fuse and secrete the acetylcholine at the junction of the organ and the axon. Done. So how it is synthesized now? See, this is the classic diagram from KDT, but most of the students don't even have idea कि ये जो yellow color की चीज है वो है क्या. What is this yellow colored thing? This yellow colored thing is this axon. This is the end of the axon inside which this axon. Can you see? I'm marking it with blue. This axon, this, I'm zooming out this portion here. So this is the axon. So how acetylcholine is synthesized here? See, so acetylcholine synthesized from a amino acid known as choline. So this is choline. So choline is taken inside with the help of a pump known as sodium choline transporter. So this choline will go inside. It will bind with acetyl group. It is known as, it will be converted into acetylcholine. So choline कहाँ से आएगा? End में बताऊंगी. So choline is taken up by a pump known as transporter, sodium choline transporter. It will go inside, bind with the acetyl group, and the acetylcholine will be formed. This acetylcholine will go, this is the exoplasm. The yellow color is the exoplasm. From the exoplasm, it is not present in exoplasm as free chemical. It will move inside synaptic vesicle via another pump. The name of this pump is vesicular pump. Vesicular pump. Because it is going inside synaptic vesicle and it will be stored there. For a longer time, it will be stored there. When nerve of depolarization will come from here, from the brain, nerve of depolarization is arising. It is going here, here, here. When this neuron will receive the nerve of depolarization, at that time, calcium intake will take place. Calcium influx will take place. Because of calcium influx, can you see these green colored synaptic vesicles containing acetylcholine? They will fuse with the axonal membrane and can you see free acetylcholine will come out. So this is how it takes place. Can you see? It is fusing here. The synaptic vesicle is fusing here and free acetylcholine is coming out. And this is the green color is the effector organ. It can be heart, it can be salivary gland, it can be eye, pupil, it can be lung, it can be intestine, it can be urinary bladder, any organ can be there. So all organs have two type of receptors, muscarinic and nicotinic. So this acetylcholine will bind with its particular receptor, whether it is muscarinic or whether it is nicotinic. So it is how acetylcholine is synthesized, how it is secreted. Have you got it? Give me a thumbs up if you got it. So how it is synthesized? For synthesis, we require a pump, sodium choline pump, which is a rate limiting step. Again, a very important MCQ. So it is formed from amino acid known as choline. And then acetyl group will combine with it and ultimately acetylcholine will be formed. It will be stored in synaptic vesicle via another pump known as vesicular pump. It will be stored there. And when nerve of depolarization is coming, calcium influx is taking place. Because of calcium influx, fusion of the synaptic vesicles takes place and ultimately acetylcholine will come out. It will bind with the muscarinic and nicotinic receptors. Done. I would like to tell you three poisons here. Here you can see in the diagram clearly it is shown this choline is going inside. This is a pump, sodium choline transporter. This choline after going inside getting converted into acetylcholine and stored here. Can you see it is stored here in the synaptic vesicles. And then when nerve of depolarization is coming, at that time fusion takes place and this acetylcholine is coming out. Everyone give me a thumbs up if you got it. Everyone. Okay, I got it. Okay. So this is how. Now I would like to tell you three poisons. Three poisons here. The name of the three poisons is in front of you. Hemicolinium, vasamicol and botulinum and titinus. Botulinum and titinus, two poisons. So total 4 poisons are there. So I will tell you the mechanism of action. All of them are anticholinergic poisons. I will tell you how they act. Can you see in this diagram? This is hemicolinium. Hemicolinium inhibiting sodium choline transporter. So if a person is injected with hemicolinium, sodium choline transporter is inhibited. So choline intake will not take place. तो choline अंदर जाएगा ही नहीं तो acetylcholine बनेगा कहाँ से? So this step is inhibited by hemicolinium. The second poison is vasamicol. Vasamicol. It is shown here. So this poison is inhibiting another transporter, that is vesicular transporter. So here choline will go inside, it will get converted into acetylcholine, but acetylcholine cannot move inside the synaptic vesicle. It will be present free in the exoplasm, and till it is present free in the exoplasm, it is of no use. It is non-functional. It will become functional only if it moves inside the synaptic vesicle. So this step is blocked by vasamicol. And the third poison is botulinum or titinus. Here it is shown. So this poison inhibit the fusion of this one step ahead. Fusion of the synaptic vesicle with the axonal membrane when nerve of depolarization is coming. So at that time fusion is not taking place, so acetylcholine is not coming out. So ultimately all these 4 poisons, hemicolinium, vasamicol, botulinum and titinus, they are inhibiting acetylcholine release. So this is inhibiting the uptake into the axon. This is inhibiting uptake into the vesicle, and these two are inhibiting the release of the acetylcholine outside the neuron. Give me a thumbs up. Very important 3 MCQs. Line se teenon pe many time it is repeated in the past year exams. So what is the mechanism of action of each poison? Hemicolinium is inhibiting. Have you seen? So this is hemicolinium. I will show you here also. Where is my diagram? Yes, here. So hemicolinium. Let me take the different color. Okay. So hemicolinium is inhibiting this step. So here choline will not go inside. This is hemicolinium. Vasamicol is inhibiting this step. Synaptic vesicles will not be formed. And botulinum or titinus inhibiting this step. Release will not take place. Give me a thumbs up, everyone. I hope you got it. The three poisons. Now last thing. My question to you. This choline uptake have taken place. Acetylcholine is formed. It is stored inside synaptic vesicles. When nerve of depolarization is coming, at that time release have taken place. And after release, what this acetylcholine is doing? It is binding with muscarinic and nicotinic receptors. Can you see? After coming out, this acetylcholine is binding with muscarinic and nicotinic receptors. So it will not bind here for forever. Whatever organ it is, depending, it can be heart, it can be lungs, it can be intestine, it can be pupil of the eye, any organ. It will show its action in a fraction of second. In a moment, in a fraction. After that, it has to inhibit its action. So we have to destroy the action of acetylcholine. After it has shown its action, after a fraction of second. So how we will destroy? For that, we have an enzyme. The name of the enzyme is acetylcholine esterase. The name में ही उसका नाम छुपा है. Acetylcholine esterase. That will degrade acetylcholine. that will act on the acetylcholine and convert it into two things, जिससे ये बना है acetyl and choline, that is acetate and choline. Choline will be used in reuptake and formation of another molecule of acetylcholine. Acetate will diffuse in the blood. Give me a thumbs up if you have understood the destruction. So here also in the diagram I have shown you. Can you see? This is the enzyme here I have drawn. This is acetylcholine esterase. It will degrade. It will degrade the acetylcholine present there. Done after a moment of after the moment it has shown its action. So here is what I want to say. So acetylcholine is degraded into two molecules, acetate and choline. Acetate and choline by an enzyme known as acetylcholine esterase. So this is a beautiful diagram from KDT, but most of the students do not understand this diagram. Let me help you in understanding it. Here, this thing is enzyme. Can you see? This is an enzyme. This is an enzyme. This is a molecule of acetylcholine. Everyone see here. Can you everyone see here? This is a molecule of acetylcholine. So it is entering inside the enzyme. Enzyme will split into acetate and choline. So it is entering inside. Enzyme have two sides, anionic side and esteric side. So when this molecule is entering inside the enzyme, you can see this is the enzyme. This molecule will bind at both sides. First, it will bind at esteric side, then it will bind at anionic side. At both the sides, this molecule is bound. Then what will happen? A molecule of water will go. It is always hydrolysis. A molecule of water will go and it will separate the two things. So you can see here, this is acetate and this is choline. So you can see the two molecules are separated. This is acetate, this is choline, and this is enzyme. So this step is completed in presence of water. Without water, it cannot be completed. So acetylcholine will split into choline and acetate. So this is substrate. These are two products. So the substrate cannot directly convert into product. An intermediate is formed. We have studied this in chemistry. So this is substrate entering in the enzyme. An intermediate is formed. A complex is formed with the enzyme. And then two products are formed. Substrate is getting converted into product. You have to understand this if you want to understand the mechanism of action of various drugs in various chapters. Let me talk about the receptors also. Then I will come on the classification. As I have told you, we have two types of receptors, muscarinic and nicotinic. So muscarinic कितने तरह के होते हैं? Muscarinic are of 5 types, M1, M2, M3, M4, M5. But only 3 are important. So I will teach you only 3, M1, M2, M3. Nicotinic are of 2 type only NM and NN. Nicotinic N1, N2 नहीं होते हैं. NM and NN. And muscarinic M1, M2, M3. M4, M5 भी होता है but not important. So these are the receptors. You can see this is the table. Very, very, very important. You have to learn this table if you want to understand the drugs. This is our master table. In this table only I will finish first 2 chapters, cholinergic and anticholinergic. If you don't understand this table now, don't attend my lecture. So please, this is M1, this is M2, this is M3. You have to learn the organs. M1 is present in CNS, M1 is present in stomach. These two are important. CNS, it is doing for memory function. That's why deficiency will leads to Alzheimer, dementia. And it is present in stomach. In stomach, it increases the acid secretion. It increases. So, cholinergic drugs will cause acidity. Anticholinergic will decrease the acid secretion. Done. So, it increases the acid secretion. M2 present only on one organ, heart. M2, heart के अंदर M2 लिखो. M2 is present only in heart, one organ. And here it decreases 3 things. Force, rate and conduction, velocity. Force, rate and velocity. You know force of contraction of the ventricles, rate at which the ventricles are contracting, and the velocity of conduction from SA node to AV node. 3 things we are having. So inotropic effect, dromotropic effect and chromotropic. We have 3 effects now, ino, chromo and dromo. So these 3 effects, all of them are negative. So it is negative inotropic, negative dromotropic, negative chromotropic. It is decreased because we are talking about relaxed state. It is cholinergic system. So we are talking about relaxed state. Whenever I am relaxing now, currently my heart में तीनों चीज कम है. My heart rate is less, my force of contraction is less, my velocity of conduction is less. If there is a lion in front of me and I have to save my life, I have to learn. All 3 will increase. My force of contraction will increase, rate of contraction will increase, and velocity of contraction will increase. So it will occur in emergency state, sympathetic. Currently I am talking about parasympathetic system. That's why it will decrease, decrease, decrease. Have you got it? So that is M2. M3 is present over 5 organs. You have to learn the name. Number 1, visceral smooth muscles. All smooth muscles of the body. I will talk about 3, but all. So that is GIT. GIT में peristalsis, urinary bladder में peristalsis, and lung में contraction. Lung में peristalsis नहीं होता. Lung is not a illuminated organ. Lung में contractions. In the eye in the eye, in the glands, all glands of the body, salivary gland, sweat gland, lacrimal gland, tracheal gland, bronchial gland, gastric gland, all gland, in the blood vessels, and in the male sex organ, that is penis. I will discuss what they will do with chapter wise, but you have to learn. There is a mnemonic for it. M1, M2, M3. So the mnemonic is those who understand Hindi. पहले खाओ, फिर दिल लगाओ, बाकी सब काम बाद में. So पहले खाओ का मतलब M1 are present in stomach. पहले खाओ, फिर दिल लगाओ मतलब M2 are present in the heart. अब बाकी सब काम बाद में means all other organs have M3. So M1, M2, M3. This is the way how you should learn. Or this is the table for NM and NN. So NM is present at the neuromuscular junction and NN is present at the ganglion. At ganglion, I have told you, no, ganglions are present in between. We have two neurons, preganglion and postganglion. So ganglion, NN is present. Done. I would like to launch some polls based on this. Then I will come on the classifications. So I would like to launch the poll. This is the first question in front of you. I guess I can see the chat. Just give me a 1 minute. Okay. So you have to answer. Write your answer in the chat box, please, everyone. I request everyone, please. Those who are listening my lecture, preganglionic parasympathetic fibers are not carried by which cranial nerve? I'm asking not. So your options are nerve cranial. We have 12 cranial nerves now. So nerve number 3, nerve number 5, nerve number 7 and nerve number 10. So Roman number it is written. Which nerve do not carry parasympathetic fibers? I'm waiting for your answers. I'm waiting for your answers. Who will answer it correctly? I can see the chat box. I can see the chat box, please. So yes, Rajat. Rajat has answered it, but Rajat, I guess you are wrong. Anyone else? Anyone else? I have told this thing in the lecture. Please tell me what is the correct answer. Apart from Rajat, anyone else want to try? So Rajat, you have tried hard, but again you are wrong. Anyways, I think you have missed the first portion of the lecture. You have not listened to the theory. Those who have listened to the theory, they can answer now. So I'm asking about parasympathetic supply. I have told you there are two types of nervous system, autonomic nervous system, parasympathetic and sympathetic. So there are two types of nerves. Listen, there are two types of nerves. Now we have cranial and spinal. And here also we have cranial and spinal. We have 12 pairs of cranial and 31 pairs of spinal. So parasympathetic may out of 12 cranials we have nerve number, yes Saurav, you are right. Saurav is right. So nerve number 3, nerve number 7, nerve number 9 and 10. Out of these 12 you have to learn these four numbers. 3, 7, 9, 10. These are containing parasympathetic fibers. And from spinal we have 5 components of the spinal. Which 5 components? That is cervical, just a second. So cervical, thoracic or dorsal, one and the same thing, lumbar, sacral and coccygeal. Out of this, here we are taking 4 and here we are taking only sacral. So it is known as craniosacral system. Cranial में से 4 चीजें ली, 3, 7, 9, 10 और spinal में से सिर्फ sacral लिया. यहाँ पे cranial में से I will take none. Spinal sympathetic system contain none of the component from the cranial nerves. None of the cranial nerve is present. Spinal में से out of the 5 things, that is cervical, thoracic, lumbar, spinal or coccygeal में से I will take 2 things. Which 2 things? Thoracic and lumbar. So that's why it is known as dorsolumbar or thoracic. So always learn it. So you can see 3, 7, 9, 10 में से 3, 7 or 10 is in the option, but 5 is not a parasympathetic nerve. So I will exclude 5 because except is asked in the question. That's why my correct answer here is B. I hope all of you got the answer. Correct answer here is B. Now see, this is the next question in front of you. What is the origin of sympathetic fibers? I have told you very clearly. What is the origin? Whether they arise from cranial nerves, any of the 12 cranial nerves, whether they arise from sacral spinal, whether they arise from dorsolumbar spinal or none. So what is the arise of sympathetic? I am not asking parasympathetic. In the last question, I have already explained you the arise of both. So I am asking the rise of the sympathetic. What is your answer? ABCD. I am waiting for you. I am waiting for you to answer. Who will answer it? Rajat, Saurabh, Milind, anyone else? Varun, anyone, those who are listening here, please answer me. I can see other names. Anyone want to give me a try? Anyone of you? Yes? What is the correct answer here? What is the origin of sympathetic fibers here? Yes? Anyone of you? What is the origin of sympathetic fibers? So whether they are arising from any of the cranial nerve, whether they are arising from sacral spinal or dorsolumbar spinal. So from ABC, what will be your answer? Yes. Any one of you? Okay. So the correct answer here is C. It is arising from dorsolumbar. I have already explained it to you. So this is the next question in front of you. Exocytic release of acetylcholine is blocked by which poison? I have told you three poisons, not today. So is it hemicolinium? Is it botulinum? Is it alpha bungarotoxin or it is vasamicol? So which toxin, which among the following toxins is inhibiting the exocytic release, that is the fusion of the synaptic vesicle with the axon? That is the last step. So which among the following is inhibiting the last step? Which among the following is inhibiting the last step? Yes, Saurabh, you are right for the last question. Now answer this one. So which among the following is inhibiting the last step? I have told you three steps. One is inhibiting uptake in the axon. One is inhibiting the uptake in the seminal synaptic vesicle, and one is inhibiting the release. So I am asking release wala kaun sa hai? So I have told you hemicolinium. I have told you the second one was vasamicol, and third one was botulinum and titinus. So here, yes, again, Saurabh, you are right. The correct answer here is B. It is botulinum. It is botulinum. Inhibit that step. So this is the next question. It is a tricky one. Don't rush. This is tricky one. So I am asking about preganglionic fibers in sympathetic nerves secrete which neurotransmitter? Your options are norepinephrine. Epinephrine means noradrenaline. Adrenaline, one and the same thing. Acetylcholine or serotonin. So what is the neurotransmitter for preganglionic nerve fibers? I am not asking about postganglionic. I am asking about preganglionic. Preganglionic neurotransmitter for sympathetic nerve fiber. What is the preganglionic neurotransmitter in sympathetic? I'm not asking about parasympathetic. I have taught you the neurotransmitter chapter completely. Who will answer it? Who will answer it? Saurabh, would you like to try? Rajat? Anyone else? Those who are listening, I can't see the names of the others. So anyone else want to try it? Yes? So the question is tricky yet simple. Preganglionic of both, whether it is sympathetic or parasympathetic, it secretes acetylcholine only. So the correct answer here is C. If instead of preganglionic, I ask postganglionic in the same question, then your answer will become A. If instead of preganglionic, I'm asking, Saurabh, you are right, but Neha Singh, you are wrong. Neha is saying epinephrine. No, epinephrine or norepinephrine will be the answer if instead of preganglionic, I am asking postganglionic. So I guess, Neha, you have missed the first portion of the lecture. So listen the story again. Listen the recording again. Let me move. These were the posts based on till now. Now let me move to the classification. Let me start the first chapter classification, cholinergic drugs. Cholinergic drugs or parasympathomimetic drugs. So here, these are the drugs. These are two type of drugs. Listen, these are two type of drugs. Drug 1 and drug 2. Drug 1 are the drugs which are structurally similar to acetylcholine. So they are humshakal or structurally similar to the acetylcholine. So if I take a tablet of such drug, that will go inside me, that will be absorbed, that will go in my blood, and after going in my blood, since it is structurally similar to acetylcholine, it will bind to nicotinic and muscarinic receptor and it will do the same action as acetylcholine was doing. So drug is very simple in action. Drug 2 are the drugs. These are increasing the action. These are external drugs. Drug 2 are the drugs which are not structurally similar to acetylcholine. They will go, if I take a tablet of drug 2, it will go in the blood, it will go in my body, it will go in the blood. After going in blood, they will inhibit the enzyme acetylcholine esterase. What acetylcholine esterase was doing? It was degrading acetylcholine. So ulte ka ulta sulta, you know, it will inhibit acetylcholine. Acetylcholine was inhibiting acetylcholine esterase was inhibiting acetylcholine. So the concentration of natural acetylcholine will increase. Drug is not causing the action. Drug is increasing the duration and concentration of natural acetylcholine at the organ, at the receptor, muscarinic and nicotinic receptor. So there are two type of drugs. So these two type of drugs. So can you see, this is drug 1, this is drug 2. This is drug 1. It is structurally similar to acetylcholine and it will bind to the receptor directly. And this is drug 2. This drug 2 will inhibit the enzyme. So it will increase the natural concentration of natural acetylcholine, endogenous acetylcholine. So the first type of drugs are known as cholinergic agonists because these are structurally similar. And the second type of drugs are known as anti-choline esterase because they are inhibiting the enzyme choline esterase. Give me a thumbs up if you got it. So this is the classification of the drug. Now my time is over. I have to give you classification of all 4 chapters. Then we have to start the 4 chapters one by one. So the 4 chapters which we have to study here is cholinergic drugs, anticholinergic drugs, adrenergic drugs. In adrenergic drugs, I will divide it into two chapters, alpha agonist and beta agonist, and then anti-adrenergic drugs. In anti-adrenergic drugs, again, I will divide the chapter in alpha blocker and beta blocker. So total this much we have to study in the next 4 days. So every day I will take one chapter. There is no class tomorrow on Sunday. On Monday, we will take this, Tuesday this, then Thursday this, and Friday this. So this is how we will complete. And then in the end on Saturday, I will put a mixed bag MCQ based on the complete ANS. Today we have completed general portion. So one by one, in this way, in the next week, in the coming week, Monday to Saturday, you will become perfect in your autonomic nervous system theory as well as MCQ. So I will help you in solving clinical questions also after each chapter. So don't forget to join me. Just give me one more second. So here I am stopping. So thank you very much for being with me. I really enjoyed teaching you. Don't forget to give your feedback in the chat box. Your suggestions are really important for me. So whatever you feel, any modification you require, you can tell me. So next class, every day at 9 a.m. in the morning on YouTube, I have this pharma class. So this free pharma class every day at 9 a.m. You can join me live on YouTube for my pharma class. In the next week, we will cover ANS. After ANS, I will start autocoids. The next week after uske baad we will start autocoids, histamine, serotonin, everything I will cover. I will take complete pharma in the next 2 months. So you join me every day in the morning 9 a.m. on YouTube. Done. If you want detailed free lecture recordings, these are already available. So how you will go to the recordings? How you will go? For that, you have to install Unacademy Learners app from the Play Store. So go to the Play Store, install Unacademy Learners app from there. After installing, go to the NEET PG category. In NEET PG category, search my name. My name is Dr. Priyanka Sachdev. See in the background. See the spelling. So search my name. You will get my profile link there. Follow my profile link there. You will get all recordings there. Not only of pharma, of patho also, micro also, PSM also, medicine also. So many important topics recordings are available free there. But what you all need is a code. This is the code. This is the code to unlock. These are free, but you will require a code. So the code is Sachdev10, SACHDEV, Sachdev10, and PDF of notes is also available. So आज के class का PDF भी वहाँ पे available है. So why don't after the class you just go there and take the PDF from there, download it in your mobile and save it permanently in your gadget for revising it. So notes are available, free videos are available. Remember the code is Sachdev10. That is my surname. Sachdev10 is the code. Please learn it. These are the free classes. Along with it on the app, you will find paid classes also. Paid classes are of 2 types, Plus and Iconic. For free, you will require only code. So this is the code. For paid, there are 2 types. If you wish, you can take paid subscription also. So Plus subscription, you will get only Unacademy live and recorded lectures. And in Iconic subscription, along with Unacademy, you will get Prep Ladder recorded lectures also. And these are the batches available on the paid platform. One batch is for FMG, one is for Next, and 2 for NEET PG 2021. So we have NEET PG 2021 1-month package also. So in the last few days of NEET PG 2021 preparation, you can take the advantage of this package. Price is only 4,500 rupees only. You will get additional 10% discount if you use my code. Code is same. Sachdev10 is the code. This is a schedule of grand test. So every Sunday we have grand test, and this is the schedule of grand test. If you take the paid subscription, you will be eligible to participate in the grand test, and you can see your real-time ranking all over India. So these are very useful for your preparation. So I think you should take the subscription and participate and practice in these tests till you become perfect. So, and this is the test which has done today only. So that was the final bout curated by all educators available on Unacademy. And 2 more last offers for you. If you take a subscription for 12 months, you will get additional 2 months. So instead of 12 months, you will get 14 months. If you take a subscription for 4 years, that is the most cost-effective subscription available with us. So for 4 years, we are charging only 60,000 on Plus and 75,000 on Iconic. That is for 4 years. And these are the other subscriptions available on Plus, starting from 2 months till 4 years. And these are the subscriptions available on Iconic, starting from 1 year till 4 years. So whatever subscription you want, you can take. Longer the subscription, cheaper it is. See the price. See the monthly installment. So for 4 year, monthly installment is 1200 or 1400 only. So longer the subscription, price is less, cheaper it is. So if you are a first prop or second prop student, take a longer subscription. If you are an intern, take 1 month also. So shortest is 1 month, longest is 4 year. Whatever subscription you are taking, whether 1 month or 4 year, whether plus or iconic, code is same. You have to apply this code before payment, Sachdev10. You will get maximum discount, that I can assure. So just remember the code. It is Sachdev10. Apply this before payment. And don't forget to follow my profile link and use this code for free classes also. So code is useful for free classes also, paid also. For free, you can unlock it for free. For paid, you will get the discount. So don't hesitate to distribute this code to all your juniors, seniors, batchmates, and everyone, all the medicos all over the globe. So thank you. See you. Bye-bye. Just after 5 minutes, I am having a PSM session on YouTube only, that is biostatistics. So interested students can continue after 5 minutes. Join the another link.